Health officials in Snohomish and King counties are warning the public about possible measles exposure after 3 confirmed cases in a single family. The family was visiting from South Carolina right before the new year. They traveled through SeaTac Airport and stopped at multiple locations, including Marysville, Mukilteo, and Everett, while contagious, but before being diagnosed. And joining me right now is Dr. James Lewis, health officer for the Snohomish County Health Department. Dr. Lewis, thanks for being here.
Thanks for having me.
The doctor is going to walk us through how to understand the risk, symptoms to watch out for, and what next steps you should take if you might be infected. So let's start with the risks. And let's kind of put into context, if you traveled to some of these places or were in these locations where the family was, and we're going to put them here on the screen for our viewers at home, how concerned should you be?
You should only be concerned if you or any of your family are not immunized. So the vaccine works very well, and so if you know you're immunized, then you're okay. But if you are unimmunized and you're in any of those places, then the risk is fairly high. Okay. So worse for the younger kids, the infants, who haven't been able to get vaccinated yet.
That was my question for you. Who's most vulnerable?
Yeah, so older folks who are unimmunized would be high risk, but that's fairly uncommon in Washington, which is good. But infants younger than 12 months would not have normally been vaccinated yet, so they're the highest risk and most concerning for us.
Okay, do you believe there are any secondary cases already in our community?
It's hard to say. We're still in the incubation period. Right now, we're right at kind of the average incubation period from the exposure time frame, so we would start to expect to see secondary cases now over the next week.
What is that incubation period?
7 to 21 days, and average is about 10 to 14 days.
Okay, and what symptoms should people be looking out for?
So it starts out pretty mild, a runny nose and a cough and maybe some red eyes, but then it develops after a few days into a rash that starts usually up around the head and then spreads to the rest of the body, and you develop a significant fever.
If someone believes they've been exposed, or perhaps their small child has been, what are the next steps?
So ideally, if they're not immunized, then it would quarantine, so stay at home as much as possible for the 21 days after that exposure. So you'd have to look and see where you were when they were there, and then stay 21 days at home after that. And then if you become sick, call your doctor ahead of time before you go in to try and avoid exposing anyone else. They'll give you special instructions on where you should go and when you should go.
Okay, that makes sense. And this family included children that were unvaccinated as far as the reporting goes. Does this case highlight any broader vaccination concerns within our community?
Yes, unfortunately, we're having a lot of confusing messaging coming out from the federal government right now around vaccines. And so Washington State and the West Coast Health Alliance have really highlighted the importance of continued vaccine recommendations that we've had for years and years and years that are strongly evidence-based. And I and the Snohomish Health Department, as well as King County Health Department, strongly agree with those as well and encourage people to talk to their healthcare providers about that.
Yeah, a lot of those changes have been for families with children. And then is that your best advice? Speak with your child's pediatrician?
Absolutely, and then you can look at the messaging coming out from the West Coast Health Alliance and the Department of Health. Anything
else the broader public should know about this alert? You know, not always do we see something like this.
Yeah, I think just really know your immunization status. If you don't know it, either try to get your records, or you can get tested to try and find out if you're already immune, or you can, if you don't know, you can get an extra dose of the MMR potentially.
Is it harmful to get that extra dose?
No, not harmful.
Okay. Yeah. Dr. Lewis, thanks so much for being here this afternoon. We really appreciate it.
Yeah, thank you.